again, hello and welcome to this edition of Healthcare Podcast. More than two-thirds of working women in India suffer from lifestyle diseases, and according to survey conducted by industry experts, as we all know, people in today's world are more health conscious and are aware of different medical specialties. However, despite the tremendous advancement in the field of medical science, there seems to be a limited knowledge among the general public. So, in attempt to spread the knowledge about lifestyle diseases in women, we have with us Dr. Sarika Gupta. Dr. Sarika Gupta is a senior consultant gynecology, oncology, and robotic gynecology based at Indraprastha, Apollo, New Delhi. Welcome, ma'am, and thank you so much for joining us. And she will discuss more on this with renowned podcaster and influencer Akash. Over to you, Akash.
Thank you, sir. Hello, Sarika ma'am. It is a huge honor to have you on the show. Ma'am, could you do us the pleasure of introducing yourself, please?
Thank you. Thank you for inviting me on such a great topic, which is very relevant in the time. And I'm Dr. Sarika Gupta, and I'm a senior consultant gynecologic oncology and robotic gynecology at Indraprastha Apollo Hospital, New Delhi. And I deal with cancer of women, more so gynecological, which is cervix, uterus, vagina, vulva, and ovarian cancer.
So, could we start with a little about breast cancers, how to prevent it?
Sure. So, breast cancer is the most common cancer in women, and about 1 in every 29 women in India suffer from breast cancer. And breast cancer is a cancer which is related to lifestyle. So, more a fatty diet, obesity, and is related to higher risk of breast cancer in women. So that's why this cancer is more prevalent in urban areas and in the Western countries. So earlier, in our country, breast cancer was number two cancer in women. But now, as we are getting westernized and having a sedentary lifestyle and poor food choices, we also in breast cancer is very common in India too. So how can we prevent breast cancer? So breast cancer we cannot guarantee that we can 100% prevent breast cancer as we can prevent cervical cancer. uh, However, we can reduce the risk of breast cancer by having a better lifestyle, and we can detect the breast cancer at an early stage so that we can have a better survival, like close to, and get it like a more curative rate if we can detect breast cancer in an early stage. So apart from the good lifestyle choices, prevention, secondary prevention can be by doing mammography every year after the age of 40 till the age of 55, and then after that, alternate year till the age of 70, and or by doing ultrasound or MRI of the breast if somebody has a hereditary risk of breast cancer.
Uh, so, this question I want to ask you that if especially related to gynecological parts, if cancer needs to be checked, so how often should tests be, and what kind of tests should take place?
So, see, if you're talking about, especially about women reproductive organs cancer, which I'm specializing in, for that, we can prevent cervical cancer. Like, we can prevent 100%, we can prevent cervical cancer. And for cervical cancer, one needs to, after the age of 25, as per our Indian guidelines, after the age of 25, a woman should get pap smear. That is, you have to go to a physician to get the pap smear, and get a pap smear every 3 years. Or if you are in a good setup, in a high good resource setting, get a pap smear with a HPV DNA testing, and that can be done. This is called co-test, and it can be done every 5 years after the age of 30. So everyone should know that cervical cancer is caused by a virus, and this virus is very common, and 80% of the women get a human papilloma virus infection in their lifetime. But somebody who has poor immunity or some other factors, environmental factors, can lead to persistence of HPV infection, and then later on in a period of decade, means I'm saying in 10 to 15 years, if somebody is infected with human papilloma virus for 10 to 15 years, then their normal cervical cells become abnormal and then later on change into invasive cancer. So as it's a viral infection, we can prevent cervical cancer by human papilloma virus vaccination, which is ideal to do, to give the vaccine before a sexual activity, so that, as you know, that like COVID vaccine is better if you don't have had COVID, then it will work the most, it will be most effective. If once you have had a viral infection, you're taking it after the infection, then it is not as effective as if you take it with like before getting the infection. So similar about the cervix cancer vaccine. And for uterus cancer, we can reduce the risk of uterus cancer by, because this cancer is also related to lifestyle, so we can reduce the risk of uterus cancer by taking a good diet, and mm, by actually controlling the blood pressure, controlling the obesity, and and diabetes. So if you do this, then you can reduce the risk of uterine cancer. There is no screening test for uterine cancer and ovarian cancer. But however, for every woman, I would advise that every woman should go to a doctor after they've started their sexual activity, should go to the doctor every year to get a general examination and history taking, so that if at all there is some warning sign or something which the physician can recognize that this is a higher risk for cancer, then they can detect, and they can give you a good advice and get some workup or test, so that early detection can be done. In our country, I think the we detect cancer very late most of the time, because the women are go to a physician regularly.
Okay.
Okay, if we speak on abortion, after a woman has done her abortion, what are the side effects that she can expect, and how can she prevent
What are the side effects after abortion?
that?
So abortion is that, as per our Indian law, abortion your means what is voluntary abortion is not legal. So voluntary means you decide that you there should be a reason for abortion, and there is a time limit that one should get abortion is safe in this time period. So after
Right,
a certain time, two physicians can give a consent, that two physicians can actually sign that this is the reason that why doing abortion, because the risk related to abortions are higher if the gestational age is more. So the risk, if you're doing a surgical evacuation, then the risk of infection, perforation of the uterus, and then later on infertility, because you after infection, then the chances of pregnancy later on is also difficult. Then the chances of abnormal uterine bleeding after abortion, there are many problems which can happen once after abortion. So
right,
it is not as safe as people think, and they want to get it done as means for smaller reasons. So it is, and even under medical supervision, one should be careful that get it done. If like be it just try to avoid unwanted pregnancy, and if at all it happens, then get a professional help, and then they can help you with deal with all the problems. If there is a provision of medical abortion also, which can be done till 2 months, 2.5 months of pregnancy, 2 months of pregnancy. As the gestational age increases, means somebody who's getting abortion at 5 weeks, the chances of success are higher. If you're getting it at later time, like at 9 weeks, the chances are less, and many times there is incomplete abortion. If there is incomplete abortion after medical,
right.
then the chances of heavy bleeding and shock and all that, like chances of a lot of problems, hypotension, shock. So one should be very careful. Don't take any medication for abortion yourself. Always do it under the supervision of a doctor, because at all you have heavy bleeding at any point of time, you know where to go, and they will give you a set of instructions that if at all this happens, then you have to take this first aid, so that you don't lose the opportunity of the best time to treat you. So these things are it's very important that don't take it lightly, and don't take the medical, at least don't take medical abortion pills from the chemist because there are serious side effects associated with it. Chances of
Right.
uterine rupture is there if you take medication at the wrong gestational age. The pregnancy, if you don't detect that the pregnancy is not in the uterus, sometimes it is there in the tube, and you're taking medical abortion, then you will have a rupture of the tube. So there will be blood in the abdomen. The patient can die of these problems. So one should know whether she is the right candidate for medical abortion, which the doctor can decide, and then take it under supervision. Because even after that, there are significant risk to life.
It is such a
Yeah,
good
thank you
point
so
that
much.
you
Yeah,
said, because
yeah,
it has become a trend to take those pills themselves by especially young women. So it was very important to bring that up. I would
It
like
is
to ask
yeah.
you, yeah, please.
So it is important so this is what I think sex education which should be given to women at an early time, that it is important that you prevent if you don't want a baby, then you prevent your pregnancy, and how to prevent it. And actually the methods of prevention are much better than if you get pregnant and you take those kind of pills. These
Yes.
pills which you take to prevent pregnancy are much better, much safer as compared to uh, dealing with the abortion, dealing with unwanted pregnancy. They can actually have other issues later on. If when you will try to conceive, then you will have a problem.
understand.
So, I would like to ask you, what are the lifestyle diseases that are prevalent amongst women?
So the lifestyle diseases prevalent in women and men are mostly the same, but in women there are more hormonal problems associated. So the common lifestyle diseases are hypertension, diabetes, obesity, and cancers many times, autoimmune diseases, and hormonal problems in women like polycystic ovarian syndrome and and polycystic ovarian syndrome, which is the main hormonal problem
Yeah.
with the lifestyle. And cancers, with most of the cancers, I would say in women, breast cancer and uterus cancer are the female cancers, and other cancers like colorectal cancer, which is related to diet, and lung cancer by smoking, and pancreatic cancer by preservatives in the food, processed food. So gastric cancers by diet. So there are many cancers which are related to high fat diet, and other cancers too which are related to high fat diet. So there are like many diseases, even cancers are now caused by lifestyle.
Okay.
So, if we talk about imbalance of hormones, what are the lifestyle activities that can cause such problems?
So the poor lifestyle means that bad diet, and bad diet means that high carbohydrate and bad fat. So fats should be we should be taking, I think, all kind of three macronutrients which are there: carbohydrates and fats and protein. So all are important. It's not that no carbohydrate, but bad carbohydrate, which is refined carbohydrate, is bad for us, because refined carbohydrate has a higher glycemic index and gives a insulin shoot, and brings about that brings increases the insulin resistance. So once insulin increases, it is that insulin spike is detrimental to the ovaries. So that is toxic. The high insulin is toxic to the ovaries. The ovaries will not produce the female hormones cyclically as they should produce, and that will lead to an ovulation. That means the eggs would not be released from the ovary. There will be many eggs which will be seen in the ovary in the ultrasound, which is called polycystic. That's why it's called, because the eggs are not released. They are still hanging around there, and that's why the woman doesn't have the cycle. And because of the ovary is not producing the female hormones, the male hormones are increasing, and that's why the woman will have acne and increased hair growth. And with all that, because of the increased insulin resistance and insulin resistance, this will increase the insulin resistance. And one thing which can decrease the insulin resistance is exercise. So women who are not exercising are again actually go into a vicious cycle where they are taking bad food, they're not exercising, so more insulin resistance is happening, and their insulin levels are increasing, and they're toxic to the ovaries, and ovaries not functioning properly. So these two things are important. Apart from that, stress is a big thing. So stress, because many hormones are released from the brain also, so stress plays a big factor. That, as many women know, that if one has an exam coming up, if there is a project, and so many times they are delayed periods by just a small event. Somebody has lost a dear one, so even with that, a woman can have delayed periods or abnormal periods. So if you are having constant stress, then that is also will lead to the imbalance in the hormones which are released from the brain, and then affect on the ovary, put a negative effect on the ovary, and cyclical hormones are not produced. So these three or four factors, that refined carbohydrate, taking more carbohydrate and that too refined, taking bad fats means trans fats and saturated fats, or refined fats which are chemically processed, taking a processed diet which has preservatives, emulsifiers, many chemicals which we even right now we have not done enough research on it, whether it is a carcinogen or not, taking smoking. So all these things are creating a problem and causing an imbalance in the hormone.
What about alcohol?
Alcohol too. So alcohol also,
Right.
yeah. So even so, some women say that small amount of alcohol is good for us. So
Mm.
I would not say that the good small amount of alcohol is good for us, because there is a tolerance to, I think, most of these stimulants, that once you take like small amount of alcohol, then at the next time for that same stimulation you would need a little more. So
Right.
this cycle will most of the times goes on. Many times you are just taking on in every 15 days when you have a party or something, then you take every weekend, and then maybe you take 2 or 3 times, and then the amount also increases. So gradually things change. So small amount of alcohol in the very beginning, when you start to say this small amount of alcohol is good, I think that is not even small is not good, because these are addicting substances, and not even the hormones are affected. You can have like so many liver diseases even, and so many cancers are caused by alcohol. So is I think alcohol and smoking is a no and especially for women, smoking is very, very bad. They will give you other diseases like venous and vessel diseases for women. So for women, I think in this also gender risk is more for women if they are taking smoking, and later on it affects the birth of the child. It affects the
Right.
infertility more to a woman as compared to males, because in females the egg is carried by the tube to the uterus, and once you're taking smoking, then that cilia of the that is affected, and then fertility is affected. So many wrong things happen with smoking too. So I think even small amount is not I think good for females, even though they're taking it more and more nowadays, as they are taking it as the men are taking, but I think it is more deleterious to their health as compared to men.
So
And when
some
you are
women.
talking about the stress, is there any particular tips for women to avoid the stress, or any personal tips to avoid the stress?
For I think for stress, it is one should have their own me time. I think every woman should have some me time to think and to rest. And another thing is that everybody should have a hobby or something for 30 minutes at least, or just talk to a friend, or talk to your husband, or talk to somebody, so that you release the stress which you have accumulated throughout the day. And uh, and some other meditation practices are there, and workout is, I think workout does I think increase the endorphins and increases the satisfaction levels. And I think these are the main things, that exercise, take a good diet, this automatically reduces the stress. That is true that there are personality traits in women. Some women are more anxious, and anxiety and these mental issues, and anxiety is, I think it's not I think it is more in women as compared to men. So it is, depression and mental disorders are 2 times more in women as compared to men. So women need to take care of it, because they are genetically, because they are more emotional, they are more prone to stress, and they should take care of it more. So 2 or 3 things: that they should have a hobby, they should work out, they should have some me time, and do other practices, I think, which can give you some relaxation, whatever it is.
Yeah,
Right.
that's correct, ma'am. Thank you. Yeah.
So I would like to ask you that some women have menstrual cramps that are more painful than the baseline level, right? So is it normal for them to have so much pain, or should they consult a gynecologist?
So this is a very good question. I think any pain, any menstrual pain, see, menstrual pain is a common phenomena. It is a common phenomena. Why? Because the uterus releases prostaglandins to expel the uterine blood, to expel the menstrual blood out of the vagina. So just to pump it, prostaglandins are released, and any kind of this pumping activity will usually cause some kind amount of pain. So mild pain, which is bearable, is normal, and we don't give any medication for it, and we don't do any workup for it. But as somebody who has a pain which is hindering their regular routine activities, they are not able to go to the school, or they are having problems going to the school or to their workplace, or they're not able to do their household chores, or they're not able to do their routine activities in those days, then I think that is not normal. That is not normal. They should go to the gynecologist, and they can do a routine workup, which is examination and ultrasonography. And if that is normal, then they will give some kind of a, as per their severity of pain, they can give a mild painkiller which has minimal side effects, or they can suggest some home remedies or some other practices which they can say that take some home remedies whichever can give you some comfort, like hot fermentation, or can give you some comfort. But most of the times, if the woman is having more than baseline pain, then it is related to some or the other pathology. It is related to some of the other pathology or disease which can be treated, and even if it cannot be completely treated, then the doctor will tell you the prognosis, that how it can be reduced, or how you can actually continue your regular activities, because I think this is what a gynecologist is for, that you don't have to suffer in a normal, in a menstrual cycle which is going, means which is, you have to undergo every 5 days in a month. So that kind of help you should take always.
So, ma'am, can we talk a little on the issue of PCOS?
Yes. So PCOS is, I think, is the main lifestyle disease which women are now coming to us, menstrual problems, and now I would say that 30 to 40% women are having polycystic ovarian syndrome now. So 30% is like very high, very high. Means
Right.
if I'm seeing 10 women, then three will have some or the other, 3 or 4 will have some or the other problem. Why? Because 50% of the women are having bad lifestyle, poor lifestyle choices, and that's why they are dealing with PCOS. Very, very common, even in adolescent, I'm saying, in school going girls, and even in school going, in reproductive age group. So all ages are affected by this, and this is called polycystic ovarian syndrome, because syndrome is when there is a group of symptom. So that group we collectively call a syndrome. So polycystic ovarian syndrome is when a woman has delayed periods, or delayed periods with a happening every 1.5 to 2 to 3 months. They're not coming at the right time, or they are having signs of clinical or biochemical hyperandrogenism. That is means that male hormones are more. So the signs of male hormones are more means they are having more hair on the beard and the mustache, a little, and hairs all over the body parts are more because of the male hormones are more. Acne is there, or some frontal hair loss is there. So these are the signs of clinical signs of increased hormones. Or sometimes these things are not there, but when we test the testosterone levels, they are high. And when we get the ultrasound, then we can see that the follicles and the eggs are not getting released every month, and then that's why they're not having their periods, and they are in a starry fashion all around the ovary, and that's why it's called polycystic ovaries on the ultrasound. So this is why it's called a syndrome. These 2 or 3 things are if they are there, then we say that you have polycystic ovarian syndrome. Just by seeing a polycystic ovary is not polycystic ovary syndrome. Syndrome is when you have problems. Syndrome is when you have this menstrual problem, or when you have this increased, it means increased testosterone in the body. So that is a syndrome. And just polycystic ovary is not does not mean that it needs to be treated. So because it is related to, because the causative agent of this polycystic ovarian syndrome is lifestyle. So whatever medication or hormonal, like external hormones, are given to treat this. So whatever external hormones we give, it is not going to change the cause. Once if you are not going to change the cause, that is the lifestyle, you cannot
Right.
cure a polycystic ovarian syndrome. So for complete cure, so that you don't have to take the medication or external hormones, you have to work on the lifestyle. So the first, once a diagnosis of polycystic ovary syndrome is made, then the first line of prescription is that lifestyle modifications you have to do. So whatever modifications you have to do. So some women actually compare them with other women, and they say that, see, my friend is also eating the same thing and she is not having the menstrual problems, and I am having menstrual problems. So why I should be only changing my diet and everything? So everybody's body is different. So maybe at this point of time they are able to digest or metabolize the bad or refined carbohydrate, but you are not able to metabolize that refined carbohydrate. You have to make the difference in your diet because it's causing the problems. So that is important, that once you know that you're having problems with your lifestyle, so you have to change it, you have to get it to better, and you have to not see the women who are taking, they would compare that, see, they are taking smoking, they're doing alcohol, my friends are doing this, why should I have to do, I have to change my lifestyle. So if the problem is happening to you, you have to change it. So this one should know, and you should reduce whatever things we tell you, that needs to be done, that weight reduction and refine carbohydrate, and reduce your calories by reducing the bad fats, exercising more. So on the prescription, it is written that this much exercise you have to do. And if you are already doing a low intensity or moderate, then you do high intensity, because you know need, maybe you need more. And so this is the primary prescription. And sometimes we also give some medication which are used for diabetes, which reduces the insulin resistance for patients who are having a lot of problem. Their weight is very high, and they're having, and we see that the hirsutism, and they are at the severe symptoms. Then we also prescribe medications which are used in diabetes. So they are the similar medications which are used in diabetes. This is polycystic ovary syndrome, and there is one more term which is called polycystic ovary disease. So this is when the polycystic ovary syndrome is associated with metabolic syndrome. So then we call it polycystic ovarian disease.
Since we are running out of time, I would like to ask you one last question. Since it is such a common question amongst at least my friends, they are afraid to lift weights or go to the gym because they think that their testosterone level, for women, their testosterone level will raise above the baseline level and they will start having androgynous features like facial hair, right? So could you burst the myth?
No, I think this is just a myth that going to a
Right.
gym or doing more activity will increase the testosterone levels. I think going to the gym and reducing your weight will actually be beneficial for your ovaries to produce the female hormones cyclically, and see some amount of testosterone. If once your female hormones are produced cyclically, then that amount of little testosterone is going to help you more. So,
Right.
some testosterone is released by a normal ovary also. So that testosterone helps us to actually for our bone protection, and for our it is important for a libido also. So I think that amount of testosterone, little amount of testosterone which will be released in the gym, I think will help you in many other, which will increase your libido, and which will help you in your health by having improved bones and by having improved muscles. So I would say that this is beneficial for you, and it is not going to affect, it is not going to give you anything, any male patterns, because your female hormones are also getting benefited.
Right. Right. And thank you so much for giving such a informative session. I would like to
That's
thank
really
you.
insightful, man. Yeah. And thank you
Thank
so
you,
much for
Akash.
taking the time to discuss with us so many questions. Thank you so much, man.
Thank you. It was a pleasure.
Yeah,
Okay.
I'll stop the record.